Hello everyone, and hello everyone. Welcome back to the rest stop. Now, today's video is going to be so insane that it verges on chiropractic. I've got an assortment of tools, some that you've seen before, and others that you have not. And I'm going to be using them to perform a massage. Don't be afraid. I know you watch that guy do the ring dinger on people and put a cloth around his neck while an old guy yanks his head off for pain relief. This is nothing compared to what he does. I'm simply going to use these tools to measure or palpate or grade, meaning level you out. For relaxation, of course. All of this for relaxation. Nothing more, nothing less. So, I've got you here. I'll set my tools to the side, and then I'll decide what I'm gonna do with you. Feeling pretty stressed out lately. I can tell. I mean, look at this. Look at this giant hump. This is ridiculous. This is no good. I think first, I'm just gonna dust you off. It is quite dirty from my last patient, but you will have to get over it. I think that'll do for now. I'm just going to use this really soft, not microfiber, but polishing towel to just get the remaining residue, any leftover dust. I'm gonna have a sip of sleepy time tea in the morning because I can. Lavender, chamomile. All right. going to fold this over for my next client. You have to be frugal nowadays. I'm not some billion-dollar BlackRock corporation here. This is grassroots, baby. All right, so as you can see, this level, you are like this. You see that? See that bubble there? That's how steep you are. That's okay. You're off a little bit, maybe by 15, 20 degrees. We can correct that. This, I think, is probably not going to fix itself in one session. Let me think about what to do here. You get a little more even throughout the midsection. You kind of taper off a little bit, 35 degrees or so downward slope towards your sacrum. And you're actually dead even on your sacrum, so that's good. That's pretty good. This is a naturally occurring curve down here. This is probably a little bit of kyphosis from improper posture, and that's going to take some corrective exercises along with manual therapy to correct over multiple sessions. So don't worry, I've got you cleaned off. I'm just going to pick a tool. Let's do this. Let's just kind of generally grade you. Okay, let's just kind of level you out. More pressure here, of course, to try to squish that in. Oh wow, we actually might be making a bit of a difference here. This can be quite painful on the dorsal ribs, but on the muscles it's quite nice. I think we actually made a bit of a change there. Let's go ahead and check that out. Well, it's still pretty deep, but it's not as bad. Before you were this, now you're this, you were this, now you're this. Okay, so if that doesn't show you proof of practice, and methodology, I don't know what will. But I can assure you this, you will remember me after I hit you with this hammer. That gets the views. Okay, sorry, that was just a reflex. That wasn't actually part of the procedure. So I'm just going to kind of here mid-trap a little bit and just that might have made it worse. Let me just stretch you back out here. I just need to apply some positive pressure on the opposite side. I'm gonna work my way down. That indention is normal, don't worry. It'll pop back out. It's like a scene from Tom and Jerry or something, I don't know. Just, you thought I would put a block of wood there to protect you, like the other quacks do. I'm not that guy. You should have gone to physical therapy. I'm gonna do this right on top of your SI joints where there are very hard bones and ligaments and tendons. feel this? Okay, then you're fine, you're fine. Let me just take this edge. Maybe not, that might ruin my blanket. I mean your skin, okay. I might just do some fine tuning here. I am the best papa ever, of course. Let's see. No, I think that's the wrong one. What about this one? Maybe not. Oh, interesting. This I could make work. I'm just going to grab a piece of flesh and give it a good squeeze. Grab a piece of flesh and give it a good squeeze. Okay. Piece of flesh. Pinch. Piece of flesh. Pinch. Piece of flesh and pinch. Even it out. Piece of flesh. Pinch. All right. Definitely got some blood flow going there. Okay, maybe a couple more taps with the old mini hammer. It's actually my nickname in high school is Mini Hammer. That's hollow in there for sure. Are you sure you have internal organs? Alright, let me just get some measurements here. I'm gonna go ahead and let's see where the inches, there we go. And do it like this, from C7 to mid-thoracic. I would say it's about a foot, maybe 10 inches. Yeah, it's about 10 inches. Right in here's, that's pretty normal, 10 inches, C7 mid-thoracic. Some people are as much as 16 inches, you know, talking about in here. Let's see, C7 to, yeah, that's about right. So we're talking about from C7 to the lower thoracic, which is the top of your lumbar, so about 27 inches. Your lower back from lower thoracic to tailbone, just under 15 inches. We'll call it 14 inches. Okay, so that's pretty normal. You are not a giant by any means. Okay, so I'm just gonna kind of go back to my roller here. Hit that mid-thoracic, okay? Kind of rolling out from the erector spinae to deeper muscles such as the serratus or serratus, whichever way you like to pronounce it is up to you. I'm not a school teacher. It doesn't matter. Sip of tea for Milady. That's good. You can have some after the procedure if you can still move your arms. Hitting that latissimus dorsi. Some rhomboids. Some rear delt. Okay. Same thing on the other side. Rhomboids, rear delt. Latissimus dorsi. Okay. That works pretty well. That works pretty well. Now, I'm not here to pop your back, okay? You can take that nonsense down the road. I'm just putting pressure to actually do real science. Okay, I'm gonna have to cut a couple things out here. So I'm just gonna have to use my cable cutters that I've repurposed for my massage therapy, okay? I'm just gonna take a piece and take a piece. Sometimes you have to really cut through the muscle tension. Okay, now I'm just gonna wipe away some of this debris. Alright, and same thing. I'm just gonna go back to the dirty side of this cloth. It's from you, so it's not gonna make a big difference. Relax, we're not cross-contaminating here. And just dust you back off. A lot of red dust. Okay, how are you feeling? Can you feel this? Can you feel this? Can you feel this? This? How about this? Can you feel this? Can you feel this? How about this? This. Okay, your central nervous system and peripheral nervous system are functioning properly, so I just want to say thank you for coming and seeing me. You signed a waiver on the way in, so there will be no serving me papers if you do have later problems, but thank you so much for watching. I will see you in the next one, and as always, please have a good rest.